This is the Vestal Volunteer Emergency Squad.
Started back in the late 50s with a town-bought ambulance. It was a Oldsmobile, 1956 Olds, and the police department ran it. Things changed where the police could never provide the level of care that was required.
In 1975, Terry Beachline dreamed of starting a volunteer emergency service. He and 5 others who shared the dream of helping their community, along with immense community support, established the Vestal Volunteer Emergency Squad, or VVES.
There's been an EMS presence in the town since the 50s, but never to this degree of complexity of what we run today.
VVES is a proud nonprofit organization made up of both volunteer and compensated staff. It is certified by the New York State Department of Health to provide advanced life support services, the highest level of pre-hospital emergency care available. VVES is dispatched by the Broome County 911 Center, utilizing the Emergency Medical Dispatch System. Annually, we answer over 4,100 emergency calls in our service area. VVES has a long history within the town of not only providing quality and timely EMS services, but also many other related services to residents and organizations at no cost. We routinely provide EMS standby coverage for many town and school events without charge to the town or organizations requesting these services, including high school sports games and community sporting or recreational events.
2 years ago, we were given an award by Broome County for being able to cover 97% of our calls. So that's something we're very proud of.
Since October 2022, VVES has been operating out of a brand new headquarters that sits on the parkway next to the Vestal Public Library. These new headquarters, built with federal funding, has significant improvements, including new sleeping quarters, a kitchen, a meeting room, and a space to house 10 emergency response vehicles. Staffed around the clock 365 days a year, our headquarters is not only our garage and offices, but serves as a home away from home for our crews.
The rest of the staff here and the rest of the volunteers make you feel really at home, and you feel welcome. You feel like your service is appreciated. You feel like you're part of a great team.
Our 5 ambulances are outfitted with sophisticated equipment and staffed by teams of paramedics, EMTs, and drivers that are highly trained and skilled in pre-hospital emergency medical care.
Lucas devices, which is CPR machines. Every truck has them, which is very fortunate at this agency that we have that. Our extrication devices, reeves, stretchers, stair chairs, great tools we have to get the patients safely out of their house so we don't injure ourselves in the process as well as the patient.
These life-saving pieces of equipment and personnel come at a great monetary cost.
People don't realize that the cost of preparedness for an ambulance, what the true cost really is. When you look at the cost of the equipment and the personnel and having the availability of those people for when you pick up the phone and dial 911, if we're not there, then mutual aid comes in from another town, and that's an extra 5 to 10 minutes minimum for coverage. Costs of medicines keep going up because of the scarcity in some medicines. It gets tougher with the cost of an ambulance quickly approaching $250,000, plus all the equipment that goes on it at probably about another $60,000, $70,000. It's hard to keep replacing those items after their useful life of 10 years.
For over 45 years, the Vestal Volunteer Emergency Squad has provided emergency medical services to those in need, utilizing funding from private donations, grants, and a fee-for-service model billing insurance companies for services rendered. Over the last several decades, this has been enough to sustain VVES's fiscal needs while allowing the organization to remain fiscally independent of the town. However, as the cost of providing EMS continues to rise, along with the decline in volunteers at the local, regional, and state level, VVES is in danger of not being able to financially sustain our operations.
It's certainly much more comfortable to be on this chair in the ambulance than on this stretcher. When the Vestal Emergency Squad arrived at the house, they completely took over. They were amazing and told me that my heart was blocked, and then I proceeded to have a heart attack. They told me what was going on, and I had complete trust in them. And honestly, I feel that if they hadn't come, I might not be alive to tell this story today.
The insurance is not able to keep up with demands and pay what we need to operate effectively. What we're looking to do is augment with different other sources of income, and the most important one is a taxing district. That would allow us the monies to operate effectively, similar to the fire department.
A little over a year ago, we started the process of trying to establish this taxing district, and it's been a long process to get where we are now, and we are coming close to having this implemented. Nobody really appreciates EMS until the day you need us, and if we're not there to help, it can be very catastrophic.
The formation of a tax district is essential for VVES to survive. Should VVES not be able to continue to provide emergency medical services, the impact would be devastating.
Our EMS system is in a crisis. We are losing providers and seeing an increase in call volume. And one of the pillars of our EMS community has been Vestal Volunteer Emergency Squad. Their response times, being located in Vestal, certainly have a significant impact. They provide mutual aid to much of our community throughout the county as well. So they are an integral part of the fabric of EMS. To not have Vestal Volunteer Emergency Squad would be a substantial impact to our EMS system.
Local governments have the authority and responsibility to address the provision of EMS to the residents. VVES believes the best path forward is to continue to build our history of strong performance by leveraging the already existing agreement between VVES and the town. This establishment of an ambulance tax district that would be considered a special improvement district for the purpose of providing EMS as outlined by the Town Law Article 12-A, Special Improvement District Authority, and Town Law Section 198. In January of 2024, New York State Association of Counties, NYSAC, and a coalition of state lawmakers and advocates announced a package of legislation to strengthen local EMS services. In addition to several initiatives aimed at rescuing EMS, this comprehensive legislative package allows special taxing districts to be expeditiously created to fund EMS services. This initiative has significant support across New York State. In fact, one of the largest supporters and sponsors of legislation is our local assembly member, Donna Lepardo, who sponsored one of the bills.
We've been working for a while in Albany to try to address the EMS crisis that we find across the state, especially in upstate New York. So we've come up with a campaign called Rescue EMS, which is kind of ironic. It's meant to be. So we really rely on EMS to rescue us, and now we have to rescue them. One of the biggest things we want to make sure is that the public understands that under law right now, it's not an essential service. They're surprised to learn this because police and fire are as important to the general public health and safety as an ambulance. But if for some reason one doesn't show up on time, the public understands that there are shortages and difficulties that the industry is facing, that we have to make sure it is viewed as essential. So one of the things we want to do is to allow taxing districts to be formed in places where they aren't currently in place, whether it's at the county, village, city, or town level. And we're hoping to see something like that happen here in Vestal to help you stabilize your resources, have a regular source of income, and to make sure that the public who needs an ambulance gets one when they need it.
The formation of a tax district which would augment our income and allow us to continue to provide quality EMS needs to be a priority and is an urgent matter in the hands of our town board. Securing financial stability through the formation of a tax district is crucial. It is important to recognize that the agency's strength lies not only in the fiscal support it receives, but also individuals that power VVES day in and day out.
When a volunteer first comes in, we try to make sure that they're welcome. And then we show them around the station and tell them a little bit about us and why it's so good to be here. And treat them as part of the family.
You get to play a role in making possibly someone's worst day in their life a little bit better. And that's a really special feeling. We do take volunteers ages 16 and up. As a 16-year-old, you're a junior member. Once you need parental permission. Once you turn 18, you can become a full member and become a driver. At that point, you need a clean driver's license and go through the training program. If you're interested in becoming an EMT, New York State just recently changed the requirements, where as a 17-year-old, you can take the class and become certified, and then go through our internal crew chief training and become an EMT crew chief here at Vestal Ambulance.
The other part of our EMS family is the professional career staff that we have. We have a very great group of dedicated paramedics.
But if you can become a paramedic, we'll actually sponsor you to become a paramedic. You just got to make sure you stay with us for at least 2 years, and we'll pay for your paramedic course. That's how good this agency is.
For more information on how you can support the Vestal Volunteer Emergency Squad, please visit our website at www.vestalems.com.